You're watching Round Roanoke, your source for what's happening in the Valley. I'm your host, Margaret Hunter Wade. It's October and folks are going pink in honor of National Breast Cancer Awareness Month, a collaboration of national public service organizations, professional medical associations, and government agencies working together to promote breast cancer awareness, sharing information on the disease, and providing greater access to services. Here to tell us more about National Breast Cancer Awareness Month are representatives from Virginia Blue Ridge affiliate of Susan G. Komen, Dr. Bob Williams, and Janet Scheid. Thank you both for being here.
Thank you.
It's good to see you. So, I'm a female. I would like to think I know about breast cancer, but I'm guessing you're here to tell me there's some more information out there than I probably know.
Well, cancer really is a problem of the genetic dysregulation. What happens is the normal turnover of cells is disrupted, so the cells don't turn over like they're supposed to. And in fact, they don't stop when they're supposed to. And what happens is that the tumor cell grows and becomes larger, and the real problem between a malignant and a benign tumor is that a malignant tumor can invade tissues around it, and it can spread to other areas of the body. There are tumors that are not malignant and can be removed without a problem. The important part about removing a malignant tumor is to get to it before it has developed the ability to spread somewhere else that can really cause a real problem. Breast cancer is cancer that starts in the breast, and then it can spread to the brain or to the liver, the lungs, the bone, just about anywhere. And so our goal is to get the cancer out before it has spread.
Great. So, risk factors to breast cancer. Some misconceptions out there probably. Can you touch on what truly are considered risk factors and what people need to be aware of?
My answer, I apologize, it'll sound almost flippant. The biggest risk factor is being female. The second biggest risk factor is having birthdays. And those pretty much eclipse everything else. Family history is important, but family history is not as important as some of those other issues. If you have a strong family history, though, that goes a long way to increasing your risk if you're a female. And it could be your father, if your father had breast cancer, or if there are a number of people in your family who had breast cancer. The normal risk for breast cancer is 1 out of 8. So 8 women who are together, one of them is going to get breast cancer even without the family history. If they have a family history, it's a much higher risk than that.
That 1 in 8 is really, really powerful, and probably why organizations such as Susan G. Komen are doing what they do, because there's a lot to get out there and a lot of awareness. So can you share what Susan G. Komen's role is in this fight against breast cancer?
Well, we are the premier organization fighting breast cancer in the United States, and Susan G. Komen has been involved in a major way in every advance in breast cancer research. And I think that's really significant. I mean, every advance, every new drug, every new procedure has been funded, in part at least, by Susan G. Komen.
And advances have happened, but we're still not there. Hence why we have months like October, which are National Breast Cancer Awareness Month. And here locally in the Valley, there are ways that folks can get involved. So do you mind sharing some of the things happening from a community perspective, but also what folks can do on an individual level to kind of acknowledge the month?
Right. October is a National Breast Cancer Awareness Month, and in our community here, we have many events going on, many what we call third-party events where people are holding fundraising events for Susan G. Komen, but we're also holding educational and breast cancer awareness events. And if anyone out there listening is a part of an organization that would like us to come and provide educational information and awareness information to their organization, we'd be glad to do that.
Great, so that's another good service that you all provide. What are some of the other things that Susan G. Komen does throughout the year? Because it's great that there's 1 month that we're kind of acknowledging it, but this isn't just a cancer that lives for a month, it's a year-round thing. So what are the other things that you all are doing as an organization to bring awareness and to help those in need?
We participate in all kinds of health and wellness seminars and days, you know, and we go and we do breast health education. We train people on how to do breast exams. Of course, we have our Race for the Cure, which is every spring.
We have an app that can help remind women when to get mammograms.
That's excellent.
Women over 40 should get a mammogram every year,
okay,
regardless of family history. The best way to be cured of breast cancer is to get a mammogram every year after the age of 40, and sometimes people just need a reminder on that.
That's a great tool that you all have. And it's also a nice reminder for our guests that may not be 40, but they may have a mother who is, or they may be a man, but they can remind their wife or their sisters. So that's a great reminder. Quickly, the date for the Komen race, you talked about it.
Saturday, April 12th, 2014.
All right, so we'll ask people to put it on their calendar, and thank you all so much for coming in and sharing this information.
Thank you.
Thanks very much.
You can find out more about National Breast Cancer Awareness Month and other events happening in the Roanoke Valley on the community calendar coming up at the break. I'm Margaret Hunter Wade, and you're watching Round Roanoke on Cox 9. Thanks for tuning in.